If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Good afternoon, QFM peoples. How are you all doing today? Make sure you stay tuned. Don't you touch that dial, because you are about to hear 15 of the most healthiest, diabetic friendliest minutes you will ever hear on 100.7 QFM, all with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation. This is Peter Boyce here. Welcome to this special program that is especially designed for diabetics and pre-diabetics, or people who might have family members who are diabetic, and you might want to learn some tips on how you can keep them healthy. And one way of keeping them healthy is to letting them know about the Maria Holder Diabetes Center, which is located in Warren, St. Michael.
I know where that is. That's just as you pass per smart right behind you, the steps on Polyclinic, right?
Exactly. There you can get your eye screen for diabetic retinopathy. You're supposed to do that every year. The year now start. Call and make an appointment to do it. You can also visit a podiatrist to make sure you get any calluses that you have taken care of, or any ingrown toenails. You can get that fixed. You will be hearing from podiatrist Louise later on in this show, and they also have diabetes specialists, nurses, and doctors to serve you. Or you can get a vascular screening, or what is also called an A.B.I. But you might be wondering,
exactly what's an A.B.I?
An A.B.I is an ankle brachial index test, which is a non-invasive procedure that measures blood pressure in the arms and legs to check for peripheral arterial disease. But you might also be wondering,
how would I know if I should get an ABI?
We go to Dr. Nina Yap, diabetes vascular specialist with the Maria Holder Diabetes Center, to answer that question.
I think for a patient to know an ABI, they won't know, and they shouldn't know. That's not really for, I don't want patients to worry if they should be getting an ABI. I think what is the bigger scope is for a patient to know and have an upfront conversation with their doctor about their health in general, but more so about their leg health. And I guess I use that word kind of loosely. But to find out, how is their walking? Are their legs cramping when they walk again from that bus stop to one bus stop? As a diabetic especially, your feet should be checked, especially in between the toes at every doctor's visit. So whether it's every 3 months you go, or however often you're going to your doctor, your feet and in between your toes should be at least looked at to make sure there's no ulcer that you're missing. Because as I mentioned before, diabetics' nerve endings in the feet are not as sensitive and are not as quick to pick up problems as someone who is non-diabetic at the same age. So someone who's 50 with no diabetes, they can feel when they maybe have something on the bottom of their foot. Someone who is a diabetic at the same age is less likely to feel a problem on their toes or on their foot. So I don't think, honestly, I'll be right up front, I don't think a patient should worry, should I have an ABI? I think the bigger picture is me and my doctor should be talking about how are my legs doing if I'm a diabetic. My feet should be getting checked. My pulses should be getting checked. They should be checking how is my feeling compared to my last visit. Are my nerves getting a little bit dampened or less feeling than before? Those are the things to be looking out for. And if your doctor is seeing a difference in your visit or feeling a difference in your pulses and heartbeat down by your feet, then they will go ahead to the next step, which yes, most of the time includes an ankle brachial index, as well as some other tests. But I think having a conversation every time, especially as a diabetic, about your feet is where to start.
Thank you, Dr. Nina Yap. And you listening to QFM just heard Dr. Yap saying about how having a conversation about your feet is where you should start. And you know who you should have that conversation with?
I know, a podiatrist.
You are absolutely right. Podiatrist Louise Robinson, who you can find at the Maria Holder Diabetes Center. So at this time, let me introduce you to Podiatrist Louise.
Thank you.
Louise, tell us a little bit about yourself.
Well, obviously you can tell I'm English. I trained in the UK at the University of Salford in podiatry, and recently I'm qualified. Come to Barbados. Why? Because my parents are from here. I love Barbados, love everything about it, sea, sunshine, and I'm glad to be here.
So what made you decide to specialize in podiatry?
Well, my mother was a diabetic and she suffered with her feet. Previous to that, I worked in the UK in the NHS as a nursing assistant. So I worked in the GPs, so I know the prevalence of diabetes and the problems it's caused. And coming to Barbados, knowing the amputation rate is being so high, I was hoping to be part of a team to reduce that. So that was the reasons why I chose to go into diabetes and podiatry.
So diabetics who might be at home listening, what would cause them to want to seek out your service and come to the Maria Holder Diabetes Center?
Well, diabetes is a huge issue when it comes to dealing with your feet. So people should never forget that. People always think, well, the diabetes, it's my sugar levels, my eyes, my kidneys, my heart, but the feet are really important. I would rather see people before problems occur so they can come to me for basic foot checks. If they've got problems with the nails, ingrown toenails, callus, the hard skin at the bottom of the foot, that's very important for people with diabetes, that they don't leave that, because that can build up and underneath it can build into a pressure wound and cause an ulcer. Then from there, that's how people then have amputations. So they should be coming to me for foot checks. I can listen to their heartbeat and their heart rate through the feet. Any corns or calluses, like I said, I can remove those, and just talk about general good footwear and how to be healthy and eat well and keep control of the diabetes, and make sure that they don't walk barefoot, and just give them tips of checking the feet on a daily basis and what to look for. So that's why they should be coming to see me for prevention. I'm here Monday, Wednesday and Thursday. Our doors are always open at the Diabetic Centre. Any concerns about family members, please give us a call and come and see us. I'm always happy to discuss any needs, look at your feet, give you some advice, and that's what we do. Just keep well and keep checking your feet.
Thank you, Louise. You heard Louise. Keep checking your feet if you are diabetic or pre-diabetic by taking them to the Maria Holder Diabetes Center so Louise can check them for you, so you can use those feet to stamp all over the place, including going to Q in the community tomorrow. As we go into our Q song of the day, this is Machelle Montano and the band Ecstatic from Trinidad with the song Footsteps. Compliments the Maria Holder Diabetes Center.
You make it dance for shame. Causing earthquake, for goodness sake. I wanna stop with you. Come on. Footsteps, stop it harder. Footsteps, stop it harder. Stop it harder. Stop it harder. Footsteps, stop it on the ground.
Keep checking your feet. Keep checking your feet.
The Maria Holder Diabetes Center.
If you are going to queue in the community tomorrow, chances are you will be eating. Or even when you're eating in general, you need to focus on your nutrition. So to finish off, we will go to the dietitian with the Maria Holder Diabetes Center, Victoria Cox, to talk about healthy eating. Listen to this. You might be about to eat something now that you might have to throw off your plate.
With a specific focus on nutrition, I'd like to just spend a little bit of time talking about some core aspects of healthy eating that would be be applicable to everyone, but definitely those living with diabetes in particular. And I just feel like I always have to start off with coming back to one particular area, which is trying really hard to stay away from sugary beverages or sweetened drinks. And this includes, soft drinks, drink mixes, any form of juice. At the end of the day, especially for those living with diabetes, drinks with sugar are such a contributor to high blood sugar levels, and it, is really in everyone's best interest to completely leave them out or at least cut down on them. And this may look different for everybody. So if you are somebody who includes juices or sweet drinks on a regular basis, maybe take a look at where you are currently. How many do you normally have per week? And then set a goal for how to reduce that. So for example, if you have some kind of juice or sweet drink once a day, decide, okay, for the next month, you're going to cut that down and have maybe 2 a week or something of that nature. The ultimate goal really is to try and phase them out entirely. And what can you have instead? Of course, we want to be drinking plenty of water as it's so hot nowadays, but you can also have, soda water, sparkling water, any flavor of unsweetened tea. You can sort of experiment, make some cinnamon tea, cool it down, drink it as an iced tea, squeeze some lemon or lime into water, soda water, squeeze an orange into your water or your soda water, and play around with some options such as that. But it really is such an important area to focus on, and it's basically always the starting point that I begin with when talking to those living with diabetes and talking about a healthy lifestyle. And second to that, with the focus on nutrition, is really going to be trying as much as possible to eat food that is prepared from home, because you just have so much more control over both preparation method, the components of the meal itself, and the portions. And those are things that are undoubtedly relevant when you're trying to eat healthily. So preparation methods, we're really trying to stay away from anything that's deep fried or anything you would describe as super greasy, oily, or adding a lot of sugary condiments like barbecue sauce. Going heavy on things like barbecue sauce can cause blood sugar spikes. And in terms of components of the meals, you can make sure that the meal is balanced. So choose one high fiber, complex carbohydrate or starch, for example, sweet potato or brown rice and peas. Pair that with a lean, non-fried protein like chicken or fish. And of course, some kind of vegetables or salad of some nature, which is not always available when you're purchasing food. So you have all three components of a balanced meal. And as mentioned, you have control of your portions, because not everywhere gives you the option of kind of really controlling the portion when you're purchasing food. When you're at home, you can really try and abide by the plate method, which is that you serve yourself the largest component of your meal to be veg or salad, and then the remaining sort of half of your plate or container or flask would be split between your starch and your protein. So you just have that higher degree of control and can make the meals that much healthier. So with our focus on nutrition is really going to be phasing out, cutting down sweet drinks, sugary beverages, and trying to eat more home-cooked meals that are balanced and have plenty veg, smaller portions of starch, and non-fried protein.
I have had diabetes for just about 8 years now.
How did the services of the Maria Holo Diabetes Center help you?
I utilize the diabetes specialist nurse, the podiatrist, the nutritionist, and of course the doctor. The staff there, but it is really nice, and they're supportive, and they help me through a lot of my problems. They taught me about calorie counting, learning how to balance my meals. They helped me not to be insecure about having diabetes. It's something that I have to live with, and to love myself, to be confident in everything I do.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier
to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care it involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care.